Good morning, good afternoon, good evening. Welcome to you all, wherever you are in the world. My name is Chris John. I am FIP lead for data and intelligence and lead for this COVID-19 program of events that you are joining today as the first event. So welcome to this FIP digital event, the first, as I said, of a special webinar program about the continuing response to COVID-19 and how we prepare for future pandemics. Pharmacists and pharmaceutical scientists continue to play an important role in the fight against COVID-19 and for planning the population's health. Lots has happened in the last 2 years. I'm sure you would agree with that. Fittingly, this program is called How COVID-19 Has Changed Us, Pharmacy and Pharmaceutical Perspectives. The program is composed of 7 episodes that will focus on therapeutic advances, changes and developments across practice, science, workforce and education, as well as policy, as well as preparing us for future pandemics. Today's event, COVID-19, Where Are We Now and Where Next, will allow us to explore the current COVID-19 situation from these perspectives and think about the future. Later events in the FIP COVID-19 program will zoom in, if you excuse the pun, on each of today's themes in much more detail. This all coincides nicely with, firstly, World Health Day, which is tomorrow, and secondly, the launch of FIP's Sustainable RX microsite. World Health Day marks the anniversary of the founding of the World Health Organization in 1948. The theme this year is universal health coverage, which is WHO's #1 priority. Progress is being made in countries in all regions across the globe to ensure everyone can obtain the care they need in the community in which they live. But millions of people still have no access at all to healthcare, and millions are forced to choose between healthcare and other daily expenses, such as food, clothing, and even a home. Pharmacy, as we know, a key component of any healthcare system seeking to achieve universal health coverage. Today, the FIP Sustainability RX team will be joining us to not only launch the new sustainability microsite, but also to highlight one of the most important work streams of this program, which is pandemic preparedness. A few days from now, on April the 9th, we mark 800 days since the start of the COVID-19 pandemic. This only serves as a reminder that we're, as a health profession, here to ensure that we're prepared to continue to respond to this pandemic and future ones. The team will highlight later on how the plans will emerge this year. Okay, if we move on to the next slide, please. I'll just go through some announcements before we get going in earnest. We've got some fantastic speakers with us today who have an enormous wealth of experience. We are providing everyone with certificates of attendance. You'll get those via email after the event. The event today is being recorded and live streamed via YouTube. Hello to everyone listening to this later. So the recording will be available on our website, and you can see the address up on the screen now. You may ask questions using the question box provided. Our speakers will be able to respond to those during the event. And you're welcome to provide feedback on this event or any others to webinars@fip.org. We would also encourage you to become a member of FIP, and the link for membership registration is again shown on the screen right now. So today's program, I've mentioned World Health Day and 800 days since the start of the pandemic. Shortly, I will be handing over to our Sustainability RX team. And then we will be focusing on COVID-19. Where are we now? Where are we going next? Through the lenses of practice, science, and education and workforce, before summing up and closing at the end. And I will be introducing all our illustrious speakers just before their sessions. So the learning objectives for today are to describe the functionality of the Sustainability RX website, outline the current COVID-19 situation from the perspectives of practice, science, and workforce education, and consider steps that can be taken to prepare for future pandemics. I'm now going to hand over to the Sustainability RX team, my colleagues, Dr. Lina and Dr. Sherly Meilianti, who will take you through what we hope will be a very useful resource for you. Take the floor, Lina and Sherly. Thank you.
Thank you very much for that introduction, Chris. Very pleased to be here today, joining for a few minutes just to do a special launch with you and just remind everyone how important it is to discuss future pandemic preparedness and what we're doing at FIP to ensure that pharmacy profession is prepared to always respond to pandemics. So just a very quick reminder, if you're not familiar with the FIP Development Goals, then you have to be. Please visit developmentgoals.fip.org. But the FIP Development Goals were launched a couple of years ago as a global framework for transforming pharmacy around the world. And you'll see all the goals cover education and workforce, practice and science as well. And it is our way of delivering our commitment to global health and the sustainable development agenda. One of those goals in particular is DG21, sustainability in pharmacy. And we'll go to the next slide because I'd like to describe to you how we are working hard to support the implementation of this goal. Sustainability in pharmacy, as with all the other goals, again, has 3 elements across the different professional settings. For workforce and education, we envision a world where strategies and systems are in place that utilize the workforce to enhance sustainable pharmacy and services. In terms of practice, sustainability in pharmacy is not just about the environment, but also sustainable services as well. In science and the pharmaceutical sciences, we want to see a world where scientific strategies and policies are in place to maintain consistent supply of medicine. Next slide, please. So we have launched last year, so a relatively new program, the FIP Sustainability RX program. It is our program of work that supports the progress of DG21. And currently it covers 3 key areas. Of course, in addition to being the umbrella program supporting the implementation of the goal overall and its 3 elements, we are focusing on 3 areas for DG21's program. One is responding to disasters and pandemics. So pandemic preparedness has been such a key work stream of FIP, and it's technically falling as part of the Sustainability RX program, and we'll talk to you about that shortly. Environment and planetary health. That covers climate change, not only pharmacists' role towards the environment, but also our role in mitigating the health impacts of climate change. We'll be looking at that also a little bit more throughout this year. And thirdly, sustainable services, ensuring we can continue to deliver services, which is also linked to some other goals, including Development Goal 7, which is advancing services. Next, please. So today, very pleased to share with you our new microsite that really is going to house all of our resources that to do with sustainability in one place. You can visit sustainability.fip.org and you'll see a breakdown of these 3 areas. We will be continuing to upload relevant publications, events, all resources that may be relevant to sustainability. And this will be a one-stop shop for the sustainability program. So really pleased to be given the floor today as part of this inaugural event of the COVID series to share this piece of work with you. And with my colleague Sherly, we'll just dive for a few minutes into the pandemic preparedness workstream, as it very much links to today's topic. Next slide, Sherly, please. And I know I'll hand over to you very soon. So responding to disasters and pandemics is all about ensuring pharmacy is at the front line of public health emergencies. And of course, the biggest public health emergency we've all been living through the past couple of years is the COVID pandemic. And this has really brought to the fore the importance of not only responding to COVID-19, but also being prepared for future pandemics. Next, please. So a part of what we're doing is mapping our existing resources that support and guide the profession in how they can respond to disasters, human-made, natural-made, and pandemics. And of course, pandemic preparedness and response is on its own a very big area. So we've dedicated an entire work stream just on pandemic preparedness. So this slide just really summarizes some of the mapping we are already doing, and you'll see some of these programs going to be linked on the microsite that just launched today. Next slide, please. So without further ado, I want to give over to Sherly, who is going to describe to you the scope of our pandemic preparedness work that covers not only our response as FIP, an organization, to COVID-19, but also how other professional organizations around the world, pharmacy organizations, are responding and what we can learn from that. Sherly, over to you.
Thank you very much, Lina. In the next few slides, I will describe a little bit about what we have done so far and what our planning for the future in terms of the pandemic preparedness. So in terms of what we have done so far, what we actually have collated all of the key outputs and responses every 100 days for what FIP has done in terms of the responding to the pandemic. And we also collect some outputs and responses from our member organizations as well. And we aim actually to visualize this into a one-stop shop, like Lina previously mentioned. And I will show you later the video, a little bit about the video about that. So let's dive a little bit about the response from our member organizations. So we basically sent a survey to our member organizations last October, and we collect their responses, and we are currently doing the analysis of the responses about what happened for each 100 day, what the responses that they organize to their members. And I will show you a little bit like general themes about what happened. So this is like 100 days, 200 days, 300 days until the 600 days. So you may see in here actually in the 100 day, our member organizations actually, they most of them provide resources for their members. They develop a dedicated task force to respond to the pandemic. In 200 day, they organize national campaigns and digital events for public awareness. In 300 day, you may see here that they start coordinate with the government to streamline the practices, to be involved with the other healthcare professionals as well, which actually continue in 500 days as well, where they collaborate with other healthcare professionals to provide education to the public and also to respond to the pandemic. And 400 day here, you may see that they advocate actually for pharmacists to vaccinate and perform diagnostic tests. And in 600 day, they start engaging with science and research activities related on how we can support the evidence for the responding to the pandemic. We actually received 51 responses from our member organization, and we will keep building on this analysis. And we are planning to show a visualization of this analysis in the 1,000 days of our to respond to the pandemic later October this year. And let me just bring you to the next slide, which is actually also similar, which is what kinds of general themes that come up from the analysis from the response of member organization to the COVID-19 pandemic. So most of them lays into like these 4 areas, which is they actually develop a timely resources to support their members, to support pharmacists, to ensure the pharmacists have a safe workplace. So it's basically develop the resources. They also conduct evidence-based advocacy to advocate for pharmacists to allow pharmacists to vaccinate and to perform the diagnostic testing. So there are a lot of progress in our country actually in our member organizations to support the advocacy. They also conduct like adoption of the technology and doing like some regional and international exchange in terms of the technology and also in terms of the knowledge sharing. And again, they conduct some science and research as well. With this with this analysis, I would like to also acknowledge my remote volunteer who is working together with me, which is Cheng Kang Lum, or Dave from Singapore. He has been helping me with this analysis. And here it is. So let me just show to you all a little bit of video about our Atlas visualization. This is still working under progress, and we will keep building on this as well. So let me just start the video. So basically, this atlas will be embedded into the sustainability RX microsite, and you will be able to view the key timelines of global response to pandemic, the FIP contribution to pandemic responses, and also member organization responses to pandemic. If we are looking at the key timeline, this is how it looks like. You will see here, for example, in 30 of January 2020, the WHO declared the pandemic. That's the first day. And similarly, we also can see some key responses from the WHO at the above line. And at the bottom line, you will see some responses from international pharmacists, from our organization, basically from FIP. So this also like shows some timeline, and we highlight like in 100 day what we has done, in 200 day what we has done, similarly until 600 days at the moment, but we are still building this visualization basically. So if we want to look at the contribution in detail, this is how it looks like, and you will be able to see for each category, the bulletin and the resources, the digital event, for example. And if you'd like to look at only in August, and it will show the digital events, and you can also click the link, and it will bring to the web page, to the recording of the event itself. I know that I think I am running out of time actually. So this is like only a pilot actually, and we are still building on this visualization. And let me maybe just stop here, and I will go to the next slide actually to show what would be the next step. So it will be building on the visualization and compilation of the evidence. And as I mentioned before, that the atlas that I showed before, we will embed this in the microsite, and you will be able to interact with it. We will also try to mark our our 100 days to do something related to the digital events as well. And for the FIP reports itself, we are planning to launch 2 reports this year. The first one will focus more on the pharmacy response to pandemic, as Lina mentioned previously, and the second one will be how we can prepare for the future pandemic. And this is basically how we want, as we know that 2020 is basically respond to the pandemic, and in 2021 we lived during the pandemic, and in 2022 we prepare for the future pandemic, and we can make an impact together. So that's all from me and from Lina, and I will over back to Chris now. Thank you, Chris.
Thank you, Sherly. Thank you, Lina. And thank you for sharing all of those wonderful resources that are available, and just shows you how far we have come in the 800 days of the pandemic. So thank you so much. Moving onwards, it gives me great pleasure to introduce our speaker, who will be covering the practice element of today's event, Dr. Hoai-An Truong. And Dr. Hoai-An Truong is Professor and Director of Public Health, School of Pharmacy and Health Professions at the University of Maryland, Eastern Shore. He's a public health pharmacist and educator. He's published more than 30 peer-reviewed articles and 2 books. And he is also a volunteer pharmacist with the US Federal Emergency Management Agency. And as well as that, he's a member of the Maryland Response Medical Reserve Corps and Maryland Board of Pharmacy Emergency Preparedness Task Force. So who better to have to talk in the area of practice with pandemics and such like. So the floor is yours, Hoai-An. Thank you so much.
Thank you so much, Chris, and greetings to everybody. It is my honor and pleasure to be here to share with you some experience. I was asked to share about a framework that together with some of my colleagues in April 2020, right after the declaration of the pandemic, we were able to put together a proposed framework for expanding pharmacy professionals' role. So I will focus on that. Next slide, please. So how are current pharmaceutical service supporting the ongoing pandemic? What are the challenges and also opportunities ahead of us? In the next limited time that I have, I will share with you some experience from the front line as a pharmacist, like many of you, as well as share with you some strategies so that way we can be more prepared if there were a future pandemic. Next slide, please. So globally, as of 8:46 p.m. Central European Standard Time on the 5th of April, there have been 490,853,129 confirmed cases in the world of COVID, including more than 6 million deaths according to the World Health Organization. Also, as of April the 4th, a total of more than 11 billion vaccines have been given. That's a lot. That's a lot of cases. There's many deaths. There's also opportunity that pharmacists have risen to the front lines. As we all know, more than the past 2 years has been very difficult for many, many people, including many of us here on this webinar. So rather than focusing on the challenges we know that have been on the past, more than the past 2 years, I would like to focus on the opportunities and share with you the quote that will guide us today, at least guide me for the next 15 minutes to share with you. I'm an optimist. According to Winston Churchill, a pessimist sees the difficulty in every opportunity. An optimist sees opportunity in every difficulty. It is no doubt that we have been through many difficulties together over the past 2 years. So I would like to focus our attention today, not just on the challenge, but really more on opportunities. How can we make a difference? As mentioned in the introduction, I've had the opportunity to be on the front line, volunteer with the United States Federal Emergency Management Agency, as well as in Maryland. One thing I think we all can start to agree with, when everything was closed, when everything was shut down, pharmacies remained open. Many pharmacies remain accessible to our patients and to the public. An image that I share with you is from my work with the Maryland Emergency Preparedness Task Force, the Maryland Board of Pharmacy, in which when Maryland calls, pharmacists respond. Pharmacists always rise to the occasion to serve the need of the patient and of the public. Next slide, please. I would like to put this in perspective of a framework of the quadruple aim approach that, in case you're not familiar, I can refer you to the Institute of Healthcare Improvement to look for more information. But the bottom line is we are concerned about better care, better health, and lower cost for the patient in normal time, as well as in pandemic that we are still in at this moment. But today, let me start out by talking about the clinician well-being, all of our well-being. Next slide, please. If I may ask you the question, and let's talk about you, how are you? How are you at this time? Are you taking care of yourself to be able to take care of patients and others? One analogy I have heard many times when we fly on the airplane is if there's something to happen, it is important for us to put on the oxygen mask before helping the children or people around us. So as a pharmacist, as healthcare provider at the front line, how are all of you doing? What are your vital signs? How are your vital signs? What are your pulse, your blood pressure, your temperature, your respiratory rate? If we sit here, if we can take a moment to be aware of our breathing. Are you in pain? Are we in pain? Pain here is not just physical pain, but also psychological, mental health. That's another challenge that we see during the pandemic and beyond also. There are many, many situations of mental health. So I would invite you, if there's anything to take away from this presentation, to become more aware of your own well-being in order to help other people, other patients, because it is all about sustainability. If we're not taking care of ourselves, are we able to continue to sustain to help others? Next slide, please. So some brief review of the challenges that I think we're all very well aware, particularly to the healthcare system. There have been ongoing response need for healthcare system and facilities, especially during the surge of COVID cases. In the beginning, we worry about how do we prevent, how do we limit access to healthcare facility? So how can we limit community transmission? So that way the COVID doesn't spread around to many, many communities. But then after that, we start opening up and we start having guidance on how to manage operation during the pandemic, how we operate, how can we continue to provide the patient care as we have been trained to as healthcare professionals, specifically pharmacists, to provide for patients. And then we also see a need, an increase in patient care for respiratory illness, including COVID-19, whether from asthma to COPD to allergies that people may have. So there's been a lot. There's been a lot of things going on and challenge the healthcare system. Next slide, please. Healthcare facilities need to provide the care for all patients in the safest way possible for patients, and at the same time balancing the need to protect healthcare personnel. That it is truly has been a stress test for the healthcare system that have always been under stress, as we know. Healthcare system, including clinics, outpatient also need to have a plan for the surge. There are large-scale disease challenge to all ages and culture. It is severe during and enduring emotional stress by frontline healthcare worker, including all pharmacists. Next slide, please. The stress, anxiety, frustration, burnout, and feelings of being overwhelmed were the most common feeling reported by those on the front line. And I'm sure that many of you on this webinar can relate to that. As healthcare worker, we are on the front line risking exposure to COVID-19 daily. And that's a personal thing to share. I have volunteered with the US FEMA to vaccinate many times in the state, at the federal level, in the United States, including contracting COVID myself and bring it home to my family and my children. But thankfully, we were all okay because we're all vaccinated. But that's just one example. I'm sure that many of you here can relate. You may have been exposed and brought COVID to your loved one also, as a case that was happening to me. Then there's also the issue of in pharmacy, supply chain issue, shortage, unusual drug usage pattern. There's emergency use authorization. There's also service from pharmacists. How do we have socially distant patient care? Telehealth have risen to the occasion for allow us to help patients over the past 2 years. Then there's also the situation with COVID test ordering and administration. Our role in healthcare and scope of practice, of course, it varies from different countries. What are the things that pharmacists can and cannot do? But during the COVID-19, I would say that one positive thing is that pharmacists have been seen as really at the front line. Like I mentioned earlier, when everything closed, the pharmacy remained open to serve the patients. Next slide, please. We also see there are a lot of shift in responsibility for pharmacists. Pharmacists have, in addition to their regular and their duties, they also have risen to the occasion to be able to shift to the front line to, for example, providing vaccine. In addition to all the other vaccine in the United States, pharmacists have been able to vaccinate, but during COVID-19, pharmacists have expanded and given vaccination to for the COVID vaccine, including for children. With that being done or being performed, we also see increased burnout and challenge to the well-being, as I mentioned earlier, to the pharmacist's well-being. We have an expanded role and scope of practice. We have seen in the science world accelerated approval for vaccine and drug from our pharmaceutical scientists. Their work diligently help us to have the access to vaccine that Dr. Grabenstein will cover in more detail later. We have seen more access to pharmacists via telehealth. Technology has become very essential for us. Pharmacies continue to move to the forefront of the vaccine campaign. In fact, pharmacy provide most vaccine for the patient, at least in the United States, as I'm aware. Next slide, please. We also seen a lot of change to the delivery of healthcare service, as mentioned, into the telehealth. Effective communication and continuity of care is important. We've seen increased advocacy for patient engagement and empowerment in the transition. Pharmacy service have been seen in transition of care in many services, including how to obtain the best possible medication list for the patient before admission to the hospital, or to minimize procedure to minimize the spread of contraction of COVID-19. There has been a shift to electronic versus hard copy prescription, mail order, utilization of medication to bed program, and other hospital delivery services, resolving medication acquisition issue prior to discharge for the patient, utilizing patient assisting patient program and other hospital program to cover medication costs. Next slide, please. I know that one of our colleagues will also talk about education later, but I would like to briefly mention that we continue to educate our pharmacy students. Many of us are faculty, myself included. We were able to pivot very quickly in March of 2020 from in-person education to remote education, online education for the patient. For the student. And we see that we continue to face the challenge of training the student to be the best caregiver, the promoter of health, the provider, the educator, advocate. And these are the competency in which pharmacists in North America have to complete for their licensure. The photo you see on the right-hand side, you saw a couple of times, you see again, is while we are in the summertime in the United States 2 years ago in June, but we are wearing winter clothing because we work inside a walk-in refrigerator for the distribution of remdesivir across hospital in the state of Maryland. We were recognized by the Maryland Board of Pharmacy for that. Once again, when everything shut down, the pharmacists are out there trying to do what he or she can. Next slide, please. So there's also a joint professional statement in the United States discussing about the opportunity for pharmacists. There are a policy recommendation in 4 areas calling for pharmacists to have the ability, increased authority to test, treat, and immunize patients, to ease operational barrier, addressing the workforce and workflow issue that prevent full and effective pharmacist engagement in COVID-19 responses. And then also there was a call for address shortage and continuity of care to remove barrier for pharmacists to provide continuity of care if a medical product shortage exists, giving pharmacists more authority. And last but not least, there was a call from the Joint Professional Organization for reimbursement for service and remove barrier for pharmacists, so that way they can be fully and effectively engaged in COVID-19 response. This is a joint professional statement by all the United States professional pharmacy organizations. Next slide, please. I also want to remind you, bring to your attention in case you're not aware, the FIP, as early as 2016, have put out a guideline for pharmacists with many guidance. And next slide, please. These include the 4 areas: prevention, mitigation, preparation, response, and recovery. In the interest of time, I will refer you to the FIP guideline source as indicated at the bottom of the slide for more information. Next slide, please. In the United States, the American Society of Health System Pharmacists also provide guidance as far back as 2003, and these are some of the area available. Next slide, please. In the remaining time, I would like to focus on the framework being proposed in the 5 area and refer you to the publication also that available at the bottom of the slide for more detail, because that will take me hours and hours to share with you all the framework. But building on the FIP guideline and SHP statement, a team of author, my colleague and I propose a framework in 5 areas that we'll discuss in detail in the next few slides. Next slide, please. So the first area that we propose is with regard to emergency preparedness and response. As example, we're calling pharmacists. In all of these framework areas, we look at the structure, the process and outcome, and recommendation for action. As like I mentioned, you can see in the reference of the bottom of the slide, and I'll be more than happy to share also as I provide my email at the end of the presentation. I want to focus on the recommendation on these 5 areas in the remaining time that I have. 1, emergency preparedness operation. 2, operation management. 3, patient care and population health. I want to spend a minute here on this one. What are some examples of these that pharmacists can do? One thing is we can volunteer globally and locally. We can volunteer with our medical reserve corps, with our public health workforce, so that way we can be a part of the public health workforce. We are already, but we can expand our role and be more effective in volunteering. We can obtain training for us to provide care for patients as well as the entire population. Next slide, please. We can also help to educate the pharmacy student as well as provide continuing professional education for the pharmacists. Here's a photo you see that I provided training, create opportunity for my student to go out on rotation and volunteer with US FEMA, so that way they can be on the front line vaccinating also, for the student to have the real world opportunity to volunteer during the pandemic. Next slide, please. And finally, it is important to conduct evaluation, additional research and dissemination of the data on the impact and outcome of the pharmacist role. Pharmacists have been very busy doing the work, but I also want to encourage all of you to share your story, whether to publication or presentation, so that way the public and the other healthcare professional can become more aware of the activity that pharmacists perform during the pandemic. Next slide, please. Here's a summary of the 5 proposed area framework for pharmacists. Of course, emergency preparedness and response. How can we be better prepared for a future pandemic? We hope there's no future pandemic, but we know that there's a possibility with that. One thing certainly is mental health. I want to spend a moment to highlight that. I think it's important for us to be more attentive to prepare to help our colleagues, as well as our patient and the community to address mental health. And then so I will really refer you to the article at the link for more information, and I'll be more than happy to answer a question when you have reach out to me via email. Next slide, please. I want to mention one more. It's about sustainability, and I'm so happy with the launch of the FIP Sustainability RX effort here. And there was one article that I really enjoyed reading. How can we sustain the regulatory change, some emergency order for pharmacists in different countries during the period of the pandemic? How can we extend that beyond the pandemic? And the link to the article and this citation is available there. Next slide, please. I would like to close out by sharing with you that I hope in the limited time that we have together, I have shared with you some challenge to healthcare, the impact on pharmacy practice, but really, hopefully you remember the opportunity that the pandemic have created for pharmacists. Once again, I said twice, but I'll say one more time. When everything was closed, the pharmacists remained open to serve our patients. As one example, many professional pharmacy organizations became unified to advocate for change in pharmacy practice, expanding scope of practice. We hope that will continue to remain after the pandemic to ensure that we have sustainability beyond the COVID-19 pandemic. Thank you again for the opportunity for me to share some reflection over the past 2 years as a pharmacist who are on the front line during the pandemic. Thank you for your time. And I believe we have questions later at the end, or if you have questions, please kindly put in the panel.
Thank you, Hoai-An, for such an excellent presentation and for highlighting how practice has changed and how the profession has responded to the pandemic and continues to respond. If you want to follow up any of the links that Hoai-An provided, this event will be available on the FIP website later. And I would also like to thank Hoai-An for just reminding us about keeping an eye on our vital signs, and particularly those who are looking after patients. We have to look after ourselves as well. Moving onwards, we are now entering the science perspective of COVID-19. Where are we now and where next? And I'm delighted to introduce our next two speakers who will be following one another, Professor Trevor Jones and Dr. John Grabenstein. If we move on to the next slide, please, I'll introduce our first science speaker for this event is Professor Trevor Jones, who is a visiting professor at King's College London and former head of research and development at Wellcome. He is also a current member of our FIP COVID-19 expert advisory group, and I know he provides a lot of very useful advice and expertise, particularly when we're developing resources in this area. He's held many FIP officer positions over the years, and we're very delighted he's joining us today. So I will hand the floor over to you now, Trevor. Thank you very much.
Well, thank you very much. Next slide, please. So I'm going to give you a download of where we are with therapeutics and vaccines, and a little bit about pandemic preparedness. And next slide, please. I want to say to you, obviously, it's not just about vaccines, it's certainly about vaccines, but the other areas of intervention, therapeutics, are equally important. And John will be putting this in perspective after I've just given you an overview of where we are in these various areas. So let me pay tribute first to the pharmaceutical scientists that have been very, very actively involved in this with their science and healthcare professional colleagues, not just in the industry, but in government laboratories, in academic groups, and particularly in regulatory agencies. The role of the pharmacist there is really important. So let's start with vaccines. Next slide, please. Very busy field. This is the latest summary from the New York Times of what's going on. In fact, if you look at the numbers of products that are actually in phase 1, phase 2, and phase 3, this is considerable. In fact, on Monday, they announced that one of those had moved from phase 2 to phase 3. So this is very close to be up to date. And we have a number of vaccines approved. So this has been all done within the last 2 years by people coming together and sharing their facilities, sharing their expertise, and the regulators coming in and working with us. So they're reviewing the data as we go along. And one of the things I've been fortunate to do is to be fairly centrally involved in that, coordinating the industry response as well as the UK government response. Just to remind you, at the top left-hand corner of this slide, that vaccines traditionally were just, we just grew the vaccine in culture and then heated it a bit or put a bit of formaldehyde in to weaken it. So it wasn't losing its potential to produce an immune response, but it couldn't reproduce. What has completely changed the way we've been doing that in the last 2 years is to introduce mRNA vaccines that have been totally different in terms of their ability to be produced and the speed with which we can develop them, or put the vaccine components, particularly the spikes of the vaccine virus, into a harmless virus like an adenovirus, and then use that as the drug delivery system to inject into the patient to induce the immune response. Next, please. So here we have a list, again from the New York Times, of those products which have been, quotes, approved. Now, many of these have been given agreement for emergency use, but you'll see from that there are very few that are ubiquitously approved. Even in the United States of America, there are products from Europe not approved and vice versa. And these are again, you see how it works. They're either delivered by taking the messenger RNA of the spike and getting the body to reproduce that to induce the response, or inactivated, particularly those coming from China and Russia, or they are simply taking the protein structure of the virus and using that as the challenge. Next, please. The issue, I suppose, is how long is all this going to last? You all know that with influenza, we have to give this every time there's a seasonal need for it. It's very short-lived in that response. Whereas some of the vaccines which you had when you were a child are going to be there forever for you, or at least you only need a booster every several years. So with the speed with which we've been developing these vaccines, the issue has been, how can we monitor them on an ongoing basis by going back to the patient population and establishing really how long and how short-lived or very long-lived they are. So the role of the pharmacist there in collecting this data with healthcare professionals is absolutely critical. Next, please. Clearly, one vaccine on its own might be satisfactory, but with the urgent need to get as many vaccines as possible to as many people as possible, we've made a point of mixing and matching these different vaccines, but doing it in a way that's collecting the scientific data to see if we can say whether an mRNA vaccine, together with, say, an adenovirus vaccine, produces a better or inferior response. And the question then is, how many times do we have to have the jab? One of the Q&A box questions was, should we be giving booster jabs to particularly senior people and those who are vulnerable? Absolutely. A single jab is not likely to be sufficient. 2 jabs might help, but after 6 months or so, it tends to decline. And so in Britain, at least now, virtually everybody's had a 3rd jab, and we're starting with a population over the age of 75 to have a 4th jab. But because these vaccines may lose their potency, the big question for us going forward is, will we need, just like the flu, to modify the vaccines every season and throughout the world have an annual jab program? If so, that's a massive challenge in logistics, and especially for the role of the pharmacist, which I know the FIP group are going to address, and we've heard about that. Next slide, please. So if we could do this in a more convenient way than sticking needles in people's arms with all the issues that are involved in sterility, the cold chain to bring the vaccine to the community, then that could speed up and cheapen actually the availability of these to the developing world. So delivering these through the nasal septum is one that's in progress. A lot of companies now looking at that. Clearly, people who have got respiratory conditions might not get the dose, but there's a good reason to look at that. And particularly if we could then have, using pharmaceutical science and drug delivery systems, to encapsulate the vaccine protein or component in a liposome or what it may be, and put that in a capsule or similar thing. So we could swallow these or at least make the injection heat stable. And separately, the big challenge is to produce a vaccine which isn't going to be required to be revisited every season, but could be pan-coronavirus. And here's some examples of companies and universities that are involved in this. My own company in California, TechImmune, we have looked at 3 million coronaviruses, found 7 epitopes in the virus that are conserved, and we're now starting to make a universal coronavirus vaccine against that. Others will come in as well, but that could revolutionize the way the frequency with which we have to do it and the methods. Next, please. So turning now to other than vaccines, obviously, if your body can't make the antibodies, could we give them by cultivating them in the laboratory? And then they would neutralize the invading organism. Next, please. So basically, a vaccine and your body's antibodies grab hold of these cells, particularly the surface cells, to stop them invading the rest of your tissues. But you also need to kill these cells. So we need not just the sort of policeman antibodies, we need the soldiers, the T cells, to come there and actually knock these things out. Next, please. These are the 3 neutralizing antibody products that have been currently approved from Roche, GSK, Vir, and most recently AstraZeneca. And you'll see from the names there that they're not exactly all entirely new. They're, using products we already had and establishing whether in fact we can combine those and whether they work against not just any initial virus, but the Omicron and its subtypes. And the last one, the Evusheld from AstraZeneca, was actually getting from convalescent patients B cells and making an antibody to that, very specific that way. And John will cover where we would use these in treating patients. Next, please. Antiviral drugs, obviously very important. I had the pleasure of leading the team at Wellcome that discovered the first drug for HIV/AIDS, AZT, and the antiviral drugs like acyclovir for HIV, for herpes. So next slide, please. There's 440 different antivirals now in clinical studies. Isn't that great? That what we've tried to do is to see whether any of the existing antiviral drugs could be repurposed. But frankly, that's not really going to work very well. These are designed to hit particular pathways in a particular virus. So the idea is to find specific antiviral small molecules that actually can attack the viral's RNA, DNA, and actually arrest its growth. Next, please. And here are the 3 that have been approved by the either the EU or the FDA, from Pfizer, Gilead, and Merck with that small company Ridgeback. And again, remdesivir obviously is a repurposed product, was originally worked on for SARS and MERS, but obviously has some value in terms of COVID. But you have to give it, intravenously once a day for 3 days. Now, logistics of that, you've got to be in a very different situation than just giving some tablets twice a day, which is the other ones. So there'll be more of these coming out quite soon. Next, please. Because of the need to think about pandemic preparedness, last year, as the UK, Great Britain, was the president of the G7, the government here set up, with the agreement of the ministers of the G7, a pandemic preparedness task force. I had the pleasure of being part of that. And that has come up with these roadmaps for diagnostics. We heard earlier the need for pharmacists to get involved in that. Therapeutics, and the challenge there is to have some, if you will, oven-ready products, to 25 different candidates that have been through phase 1 studies, and actually we've made the chemicals, we've got the clinical trial material ready. So the day that we find out what the next pandemic virus should be, we can then within 100 days deliver this to the market. So that means streamlining all the clinics, streamlining all the regulatory, and agreeing to support both academia and industry to do that. And similarly, with vaccines to develop these libraries against 10 prioritized families that we then can work for 100 days to get through to the market. We did it in probably a year and a half. The idea here, we think we can do it in that time. But not just that, but actually to make sure that we are sharing biological samples. And the thing that really was very difficult for this pandemic to date was what's equitable access. You know, how do you make sure that people in the world get access to these vaccines, and not just in the privileged developed world? Not easy, and especially when the healthcare infrastructure in many of those parts of the world is not as well developed. So that's been taken forward by Germany as the new president of G7, and we shall have regular meetings to revisit this. Next, please. Just to give you an example in terms of antivirals, therapeutics, there are a whole series of companies and groups here listed that actually have started this program to get these 25 oven-ready, if you will, products to the point where we can pick them once we know the pandemic. And CEPI listed there is an organization already established to coordinate epidemic and pandemic activities. And they've just put a challenge up to see if we can find an even better than mRNA approach to delivering vaccines. And then last week, we had the announcement from the Gates Foundation of their big new therapeutic accelerator. So this is a highly active field. It's costly, and the money's being found from industry and from governments and so on to bring together all this to find those 100-day ready antivirals. Next, please. So I'm going to hand over to John, who's going to put, I hope, some of this in perspective. John, over to you.
Thank you, Professor Jones. Appreciate the time. Chris, why don't we just, my mother loves me.
Are you happy to introduce yourself, John, or would you like me to do that for you?
I'm fine. Let's go for content.
Okay.
Thank you. So this piece of science I'll pick up is the epidemiology and implementation science. It's an incredible tribute to pharmaceutical scientists that we have vaccines, but the challenge now is getting them to the world. This is a graphic by country of doses delivered. 64% of the world's population has had at least one dose towards the end of March. 11 billion doses globally, 17 million doses per day, and yet we still have a great progress, but not yet equity. And so obviously Africa and parts of Asia and the Pacific Islands should be standing out to you with the lighter colors. I looked at this map or this data source yesterday, and the situation's improved a little bit more. Botswana and Mozambique have deepened in color. Peru has, several other countries. So progress continues to be made, but we must continue to vaccinate. There was a question in the chat box about, or in the Q&A box about herd immunity. There is nothing better than personal protection. We continue to vaccinate against polio around the world, even though there is so little polio, but with so much COVID, we must continue vaccinating around the world. Next, please. If you're interested in how your country compares to others in terms of the percentage of your people who are vaccinated, that would be the left-hand panel on this graphic, and there are hundreds of countries not shown in this little version, or the number of doses delivered or provided to the countries. That's on the right-hand box. But suffice it to say, there is still much work to be done. Next. So in my priority scheme, I would rank prevention first, testing next, treatment next, and support always. So to do the most good for the greatest number, the simple thing is to get those vaccinations delivered. And many countries have realized that in the pandemic, pharmacists were there, a valuable resource to deliver the vaccine in a way that was faster, more accessible to their population. And so multiple countries have harnessed the power of their pharmacists with their specific training to administer vaccine. As Professor Jones suggested, one of the things we have yet to figure out is how durable the immunity will be with these vaccines and what the best course is. Additional valences would be nice, as he described. And now in terms of treatment, I have coming up on a future slide some guidelines, but the most important thing to know with treatment is you must begin early, soon after symptoms develop if you want to have an effect. This is typical of all viral diseases. The number of days differs from product to product or study to study, but promptness, timeliness is consistent. The U.S. National Institute of Health suggested a preference for outpatient therapy with one of those combination antivirals, then preferred over a monoclonal, preferred over the two of the single entity antivirals. But those guidelines are only good if you have those products available to you, and that's not true, and I'm certain in multiple countries around the world. And so you must find the solution locally that matches your circumstances, and hopefully those guidelines will give you some suggestions, some options that you can put into place there. And then the role of the pharmacist in optimizing drug therapy certainly applies to identifying contraindications, dealing with drug-drug interactions, preventing and responding to adverse events, reporting them to your national regulatory authorities so that the drug's full effects can be well understood, and then providing supportive therapy. Next, please. So the caption didn't show up on this one, but this is, maybe click one more time, maybe it'll come up. But no, it did not, we're not getting the captions. Go back, please. Okay, so this is the slide about long COVID. And so a fascinating syndrome of sequelae after COVID-19 acute infection of prolonged symptoms. And so what can a pharmacist do to help that patient? Well, first, prevent it from occurring in the first place by preventing the COVID infection in the first place by vaccination. But if the patient is in front of you, what can you do? It's largely symptomatic treatment according to the specific situation of the patient. And then, we're relatively early in this pandemic. How long will these symptoms persist? Teaching the patient, coaching the patient through coping strategies can be a very valuable human, social, a matter of sociology as much as pharmaceutical sciences, but very important for that individual. And the CDC website I have there has some suggestions for care. Next, please. And the caption for this slide should be preparing for future pandemics. What can we do? I was a part of some pandemic planning efforts for the United States government, and we primarily thought about influenza. And certainly, coronaviruses are going to be with us for quite some time. But if I were to suggest to you one thing to do to prepare for the next pandemic, it would be to increase uptake of seasonal influenza vaccine. Hundreds of millions, perhaps billions of adults now realize that vaccines are for adults too, not just for their children. And so let's capitalize on that. Let's keep them coming back for vaccination against many diseases, tetanus, pneumococcal disease, pertussis, a variety of hepatitis A, hepatitis B, whole variety of vaccines that adults can benefit from. But in terms of pandemics, perhaps the best way to prepare for the next influenza pandemic is to increase uptake of annual flu vaccine. Why do I say that? It's so that the industrial capacity to produce flu vaccine each year will rise as demand for product rises, and then the infrastructure in your country, in your province, in your city, in your neighborhood increases the ability to deliver those doses of adult vaccines by practicing each year with influenza. And for those of you in parts of the world that would like a greater industrial capacity to produce vaccines, increasing demand for flu vaccine will increase the demand for, or increase the need for local industrial capacity. I think coronaviruses are going to be with us for many, many years, perhaps forever, is a significant cause of human disease. So we must not stop our COVID-19 vaccination programs. We must continue them and then apply the fruits of what the research pathways, pipelines deliver us. There will be other pathogens to consider. Certainly that'll be matters for the World Health Organization and national governments to consider, the World Bank even. So that's something that we will be following up on. Next, please. So these are the resources I offer for you. The WHO at the top, the Infectious Disease Society of America, US NIH, US CDC, the European CDC. I work for a small non-governmental organization called immunize.org. We provide free checklists and handouts and clinic materials and ask the expert columns and a whole variety of free resources to vaccinators around the world. You're certainly welcome to take advantage of all the resources that we have there. And next, please. So I'll turn it back over to Chris.
Thank you so much, John, and thank you to Trevor as well. Thank you both for your excellent presentations and showing how enormously science has helped us over the last 800 days of the pandemic. Where would we be without all of this fantastic scientific progress? We had no vaccines 2 years ago. Okay, moving swiftly on. We have another double act for you. I'm very pleased to have with us Dr. Ali Dering-Anderson and Dr. Sean Gleason, who will be taking the education perspective of COVID-19. Where are we now and where are we next? I'll just do some brief introductions. Next slide. Dr. Ali Dering-Anderson is a clinical associate professor in the Department of Pharmacy Practice and Science at the University of Nebraska College of Pharmacy. She is a very valuable member of the FIP COVID-19 Expert Advisory Group. And as her role at the university, she coordinates and teaches across courses and is a preceptor for public policy experiential rotation. She's a fellow of the APHA and 2019 president of the Nebraska Pharmacists Association. Next slide, please. And Dr. Sean Gleason, who is Assistant Dean for Distance Degrees and Programs and Associate Professor at the Skaggs School of Pharmacy and Pharmaceutical Sciences, University of Colorado, Anschutz Medical Campus. Dr. Sean Gleason is part of the FIP Workforce Hub and is inputting in a lot of our programs of work. So thank you both, and I'll hand the floor over to you.
All right, thank you so much. I'll get us started. And so it's our pleasure today to speak to everyone about education that has taken place in the era of COVID. And as my friend Ali and I began planning for this presentation, we realized early on that we were coming to it from two very distinct directions. I was taking a look at it from the academics direction. As Chris mentioned, I teach online at the University of Colorado, and Ali was coming to it from the more of the practice and the workforce development training direction. So we thought, well, you know what, this is cool. We can still talk about these three main areas: adaptations, innovations, and challenges ahead, but we'll take a look at it from two different directions. So that's the way we're going to provide this section of the presentation. We're going to kind of be tag teaming or going back and forth. So I'll get us started with the academic side. So next slide, please. So I think we all recognize, so the first part I'm going to talk about is adaptations. I apologize, somehow I missed the subtitles on the slide. So the first part is about adaptations. And as I just said, I think we all recognize the picture on the left. We're engaging in it right now, the Zoom conferences, Teams, what have you. And as I think a lot of us know, as we looked at education in the era of COVID, the first thing almost all educational programs did was what those of us in the online world we did the rapid pivot to remote education. And as I said, there's those of us in the online world call this something distinctly different, remote education versus online education. And this is important for us all to understand, especially as we move forward, because each of them have distinct advantages. So what I did is I was reading through the literature, and I'm happy to provide a vast citation list for you all on this, is I took a look at it and I thought, you know what, let me just make a table to really explain the differences between the two and why they're so important. So if we look at what was done by most of us, the remote education, that's, as I said, it's Zoom education. It was what professors did. We took our face-to-face lectures and we put them on Zoom and we delivered them live to our students. And honestly, that was the quickest, easiest way for us to make that transition to education, and thus we call it the rapid pivot. As far as, I'm going to go down to the second line on the table, the timing of it it's what we call synchronous. It's live, it's in real time. And that was kind of nice as we get to the next line, as we considered engagement. I know a lot of my colleagues said, oh, absolutely, we want to do it by Zoom. We want to have our students there with us face to face, so we can still continue to talk to them even though we're not there live. And indeed, you can do amazing things on Zoom. You can do breakout rooms, polling, etc. And you can talk to the students live. I think the downside of what some of us quickly saw is what my dean, Ralph Altieri, calls, we became Zoombies, where, being on a remote presentation for a long time, it does get tiring, especially if you're a student doing it for 6 to 8 hours a day. The other thing to consider, especially as we're in different parts of the world, or I even experienced this here in Metro Denver, was bandwidth considerations. And we're seeing it today. Most of us don't have our cameras on to save bandwidth. So that is something to consider as we think about remote education. On the flip side, online education is what a lot of online programs have been providing for years. Now the difference is it's not as rapidly done. Providing online education really requires some intentional design. Often we need instructional designers to help us with it. It's those recorded lectures, or as we now know, mini lectures, maybe 10 to 15 minutes to help with attention spans. It's typically, as far as timing goes, asynchronous. So it's education that students can access on their own time. But then we get to the engagement, and some might see that as the downside, is that, well, the students aren't there with us in real time. But believe me, there's a lot of collaboration that can take place in this asynchronous manner. Things like threaded discussions. I've seen my students just blossom in threaded discussions, wiki type documents where they can work on a project together, and so on. Now, the upside of it is the bandwidth issue. Now, sure, sometimes uploading these vast files might take some bandwidth, but then when the students access it, it's one at a time. So it does take less. And so as we move forward, there are advantages to both that we can consider as we move on. So, and then before I go on to the next slide, I'll just also talk about the changes in experiential education, because these were vast and amazing. As we went to remote, so did patient care. So there were a lot of telehealth opportunities, remote experiences, a lot of amazing things being done in simulation, and I'll talk about that later, as well as in laboratories. Although I will say the laboratory has and remains, has been the greatest challenge. So with that, let's move on to the next slide, please. For our next adaptation. And really the biggest thing here is to really highlight that all of us, whether it be students, faculty, or our supporting team members, we are all rock stars. We went through this in a rapid period, and really learned a lot about each other. And as far as some of the things that we learned, communication was one. We learned the importance of it, how we do it, whether it's live, whether it's online, how often we do it. That's something my school is still struggling with, is how often do we communicate to our students? Our students held up their hands and said, enough already, please stop. And so it's a balancing act. And then, as Hoai-An mentioned, I think really the take-home lesson that we learned and we had to adapt to very quickly was the importance of wellness, especially in the times of COVID. We had, practitioners who were at risk of COVID. We had faculty members who were teaching their own children at home at the same time. We had students struggling with ill family members, just all of that. And so wellness became something that was so important. And then along with communication was interaction. We really appreciated that, we appreciate interacting with each other. And that's something that we're taking forward of trying to figure out what is the best balance of that, whether it's students to faculty with each other in collaboration, as well as peer-to-peer engagement of students. So with that, I'm going to hand it over to my friend Ali, who can talk to us about workforce development. So next slide, please.
Greetings all. I think one of our biggest challenges when we consider how are we educating the workforce was we didn't all start at the same place. When we are talking about students, we know which class they had last semester or last year. When we're talking about our workforce, some of them, like my father, graduated in 1960. Some of them, like my daughter, graduated in 2012. So to figure out how to start, what's the baseline for these folks was one of our biggest challenges. And certainly I am talking about educating the workforce through sort of an academic model. Every employer has their own mini training modules and rules and those kinds of things. But this was taking a very vivid pharmacist workforce and saying, as Dr. Truong pointed out to us, this is the only place that's open. Come on in. We are healthcare providers. We want to do our part. And we suddenly needed them to know about masks and cleaning surfaces and all of those things. And some knew how to provide vaccine, others did not. So our big adaptation was we needed to go back and figure out, how did we first start teaching pharmacists to do that? Fascinatingly, Dr. Grabenstein was part of the movement to have pharmacist vaccinators in the United States in the mid-1990s. And we had to dig out some old stuff to learn what were we going to do with this very, very diverse workforce. It turned out that teaching from academia worked well in some cases, and we needed to relearn how we taught in other cases. But we were good, I think, at adapting our workforce education alongside our traditional education until, next slide, please. We discovered that it is difficult to do some things online, virtually, synchronous, asynchronous, whatever, when we're not allowed any visitors on campus. So how are we going to do something as simple as skills assessment? Well, I can tell you what I personally did. I drove to all of these training pharmacists' businesses or homes, and I let them inject sterile saline into my arms. After about 200 of those, my arms were pretty bruised. And then the reality of the fact that this was really, truly, severely contagious hit home. And not only was I putting myself and my family at risk, but while we had these folks distanced, I was the link that was going from pharmacist to pharmacist to pharmacist. And if I had gotten sick, I would have made a mess of everything. And it was an embarrassing aha moment for me that we needed to find a way to do skills assessment virtually. And you can do that with a cell phone, with a pretty good video camera. I can zoom in and watch you do all kinds of vaccinations using sterile saline or sterile water and keep everybody a whole lot safer. Sean has more for us. Next slide, please.
Oh my goodness, Sally. I love that emoji, and I hadn't realized that part of your story. That's fascinating, and you're right, very scary at the same time. But the thing that's cool about what you did is it's very similar to some of the challenges that we were facing in the academic world of how to do some of these skills training. So with that, let me talk a little bit about some of the innovations that have taken place in education. And, really it's an innovation that we're using now during COVID, but in reality, a lot of these innovations that we're using have existed, but we're all now becoming experts on them. And I think that's pretty amazing. So if we think about some of the innovations, the most obvious one that we all experienced very quickly was varying delivery platforms. Like I mentioned earlier, what we're doing right now, Zoom became something we all became experts at. Along with that, different collaboration modalities such as Google Docs, PebblePad, Padlet, all of that along with polling, and I'll talk on the next slide about academic integrity or proctoring services. We all became very familiar with that. And those are skills that I think we all can take forward as we move into post-pandemic or even if we go back. The other thing I cannot say enough, just kudos and all kinds of amazing words for all of our colleagues around the world about how creative we are. We quickly learned, like Ali did, that there are other ways of being able to do active learning. So as far as OSCEs or objective structured clinical examinations go, there are all kinds of ways that we can do it. We quickly learned that you can use Zoom, you can use the breakout rooms to do it. But as maybe bandwidth and other problems came about, we learned that there are other ways that we can do that. We can have students maybe educate their family members and record it for us. Like Ali was saying, you can do amazing things with the phone. We can trust our students to work together, do peer-to-peer learning. I would invite you to go back to some of the FIP webinars from early on in 2020, and then we did a 1 year later in 2021, where we go into more detail of some of these really creative learnings that we did. Collaboration, we talked about that. The other thing that existed, and I can tell you was a lifesaver for me, were some of the simulation platforms. The Mind Dispense system out of Monash University in Australia really saved me with our online students in teaching them how to dispense when they could not come to the US. EHR Go is an electronic health record simulation product, and there are others out there. So they're amazing. As far as laboratories go, teaching pharmaceutics and pharmacology labs, et cetera, are a little bit more difficult, but I can tell you I have a colleague who taught the importance of emulsions by having the students make a salad dressing. It's like, wow, how creative is that? So a lot of amazing things went on, along with that telehealth. Patient care provided by telehealth, and so it gave us a great opportunity to teach our students using telehealth out of necessity, but also as we move forward. So next slide, please, and I'll continue on about a couple of other innovations. As I mentioned earlier, one of the greatest challenges that we faced was the idea of academic integrity. How do we maintain academic integrity? So we all learned very quickly about some of these online proctoring platforms to provide that proctoring for online exams. But as time went on, different problems arose with that, whether it be students figuring out how to get around the proctoring, bandwidth issues, cost, etc. And so what it has done is really helped us innovate to new ways of assessing our students. Maybe we don't need to give those multiple choice exams, and instead we can assess our students by having them work in projects, do teamwork, peer evaluation, self-evaluation. It's really given us an opportunity to innovate how we assess our students and not have to necessarily do that online proctoring. Save a lot of money, save a lot of bandwidth. And then the other thing that I think is really interesting is we're all used to the ABCD grading or something similar. But what came about in a time of COVID is, you know what, with all of this change in how we're delivering, maybe those letter grades aren't the best way to do it because our students were struggling so much. So we went to a lot of pass fail, and then we realized that, well, that's not ideal either because we have students applying for jobs, applying for residency. So now there's a movement toward pass plus, fail. And I would say one of the conversations going on right now is the lack of consistency within that. So I think as time goes on, we'll continue to innovate of what is the best way to do that moving forward. Which parts of it do we keep, which do we do not? So with that, next slide, and I'll hand it back to Allie.
Thanks, Sean. I think one of the things that we found that was really fascinating when we were asked to help educate the existing workforce was that the people who needed the education were retired pharmacists who were suddenly going to volunteer to either do point of care testing or immunizations. Non-immunizing pharmacists who thought, gosh, I probably should have done that, but I didn't get around to it. And then those who were reluctant to either do point of care or immunizations, but their jobs depended on them developing these new skills. They didn't want innovation. They wanted practical. They wanted quick to learn. They wanted validated skills. And some of the theory, they were very willing to let go. They didn't need to understand it all. They just needed to understand what to do. And our standard is the American Pharmacists Association Immunization Certificate Training Program that goes into the theory and all of the vaccines and marketing and merchandising and cold chain. And these people needed to know how to stick a swab in a nose and how to stick a needle in an arm. And they didn't want to do it with fancy videos. They just wanted to develop what they needed to develop to help with the situation. And we had to learn how to adapt. And I think that one of our big lessons going forward, I'll talk about in a couple of slides, but that may be the biggest one of all. Next slide.
All right, well, thank you. That's interesting about the views on innovation. And I think that that's true for all of us. So now let's go on and talk about the challenges that we face moving forward. Or I really liked what our colleague, Dr. Truong, shared is sometimes our challenges are actually opportunities. And I think that's where we are with education now after having experienced the last 2 years. And so when I was reading through the literature, some 3 themes came through about where we are. And it was really highlighted as choice, wellness, and adaptability. And this image I chose really, it hopefully captures it where it kind of gets to, we all learned and need to take forward grace and kindness. So that's what that image represents. But let me go into a little bit more about that. As far as choice goes, we really need to be thinking about each other of what our choices are for delivering education. I've talked a little bit about the differences in remote education and online education, and they both have their advantages. And then meanwhile, right now, we're starting to go back to live education. And so as we move forward, and we need to look at this as an opportunity. We've got all these, really 3 distinct ways of offering education. How can we think about this moving forward, and how can we best serve each other? We need to consider, where our students are, where our faculty members are. By having this mix of 3, we can provide what is now being referred to as high flex education. Maybe we can take the best of each of these modalities and offer it to our students. So if work gets in the way, life gets in the way, maybe the pandemic comes back, we can rapidly pivot back and forth to one versus the other, and we can mix and match, kind of like our vaccines. We can mix and match how we're delivering our education. And I think that's a really great opportunity for us moving forward. And the same thing goes with workplace venue. I'm at home right now, but in a couple hours, I'm going to be in my office and we can go back and forth. And then next, wellness. I think this is something, an opportunity that we can continue to embrace and should continue to embrace for each and every one of us, whether it's students, faculty, or all of our team members. And as we've just heard, the importance of adaptability, again, being able to adapt back and forth with all of this. Next slide, please. And then finally, the greatest opportunity is something that we had heard about and it started talking about pre-COVID, and that's digital health. But my goodness, now in the era of COVID, we are living it. As I mentioned earlier and others have mentioned, telehealth is here to stay. And with that, so are other innovations. And so it's a great opportunity for us to continue on learning about digital health. And so I know I signed up for the Train the Trainer online course and need to be logging into it soon. So I encourage all of you to do the same. Back to Allie, next slide.
I think this is our last slide. So before I finish, I want to thank every single person who has participated in this webinar and watched. It matters because when we think about challenges and opportunities ahead, the thing that is the most exciting for me is pharmacy stepped up. Without us, the world would not have vaccine. Without us, the world would not have point of care testing because we were the people who were there. So when we talk about workforce education, whether we focus on vaccine provision or point of care testing or everything else we did it. And we need to take time to celebrate. We did this. What have we learned from our experiences? We've learned that it is possible to work with a mask on. We've learned how to clean things better than we've ever cleaned them before. We've learned that we need to meet our workforce where they want to learn. Most of our best workforce training is asynchronous, so that people can do it on their timeline, not our timeline. We know that we have technology challenges, so we need to find a way to use less bandwidth. But before we do any of those things, we need to look at each other and say, we did this. Yes, sadly, the world lost more than 7 million people. Without us, one has to wonder what that number would have been. Thank you. Next slide, please.
Thank you so much to our rock stars, Ali and Sean, for their marvelous presentation and taking us through how much the world has changed in education and education/workforce and how it has swiftly adapted. We're near to time, so I will take us on to the next slide, please. Thank you to all of our fantastic speakers who, to say they've brought a wealth of expertise and experience is a huge understatement. It's been an amazing amount of learning for me, and I'm sure for all of our attendees. Next slide, please. The next event in this program of COVID-19 events is the role of the community pharmacies in COVID-19 booster vaccination, opportunities and supply chain challenges in a post-pandemic scenario. And that will be on the 26th of April at 1 o'clock Central European summertime. If you go to the next slide, please, you'll see we have all of our events are on events.fip.org. So we're at time. Thanks to everyone. Thanks again to all of our fantastic speakers, and have a good day, afternoon, evening, wherever you are. Goodbye.